maintenance of blood calcium level. Calcium metabolism. Calcium is essential for bone formation, neuromuscular activity, normal cardiac rhythmicity, for coagulation of blood, formation of milk, mediation of intercellular action of hormones, fetal development during pregnancy, membrane integrity and permeability. Normal calcium level is around 9 to 11 milligrams per deciliter. The calcium is present in the different forms. The calcium in plasma exists in diffusible and non-diffusible forms. Diffusible calcium is in the form of ionic calcium is about 50% or complexed with bicarbonate ions, citrate ions, etc. about 10%. Ionized calcium is required for muscle contraction, it is required for cardiac activity and blood coagulation. Whereas non-diffusible, which is bound with albumin or globulin, is about 40%. Calcium in bone exists in two types. It is readily exchangeable form as a 1% and stable calcium almost 99%, which can be mobilized only through the action of parathormone. Regulation of blood calcium levels. Calcium is taken through dietary sources or absorbed from GI tract. Through blood, it is distributed to various parts of the body. Depending on the blood level, the calcium is either deposited or removed from the bone. All these processes are finally regulated by three hormones. That is mainly the parathormone. Second one is 1,25-dihydroxycholecalciferol, and third one is calcitonin. In addition to above mentioned three hormones, growth hormone and glucocorticoids also regulate blood calcium level. Growth hormone increases blood calcium level by increasing intestinal calcium absorption. Glucocorticoids decreases blood calcium level by inhibiting intestinal absorption and increasing renal excretion of calcium. This is how serum calcium levels are regulated. When serum blood calcium reduces, stimulates parathyroid to produce parathormone, which causes reabsorption of bone and release calcium. And the kidneys stimulated and it produces 1,25-dihydroxycholecalciferol, and also in the intestine it increases the absorption of the calcium, thus the blood calcium comes to the normal. When there is increased calcium level, there will be stimulation of the thyroid gland, parafollicular cells produces calcitonin, it acts on bone, causes deposition of the calcium and reduces the calcium